So we have a 73 years old patient with this lesion in the transverse colon. So we were going for an ESD with the inspection of our lesion with the underwater under saline immersion technique. It's a nice to connect to a lesion, but I don't have big implementation basis. So I think I will change my plane for EMR. I think it's a 2 centimeter maximum base. So if you put the water here, we see that the lesion is moving from up to down. So I will put the maximum of water now. And you see this edge here. This is a little stalk, and we can go just around it. So we always have the option, but I will try first to inject to see all my lesion, and I see all around tissue here. So I'm pretty happy with this position. I just want to check the distal part to get a one-piece resection. If I'm not able to do it, I will do dissection of all the around tissue. We'll check again with the NBA, and we see a normal pit pattern, no suspicious area. I will suck the air here and come back to the TXE mode. So I will begin injection in the distal part. Purge. C'est bon. This is our needle cam. I will search for the nearest place in the stalk, which is, I think, here. So we see the polyp kharja. So I will just try to be stable with my cap, like this. Injector. So we are in the submucosal layer, and we see inject. So here it's okay. Stop. I will go to the other distal part, just all around my polyp. I will just inject here. Injector. We see a vessel there, so we expect some bleeding here. Stop. Stop. I have just to go all around my lesion. Injector. We see it under the cap, in the upper part of the cap at 1 o'clock position. Stop. So I'm going slowly all around. Injector. Inject. So I have to see all my lesion coming in and seal all the surrounding tissue. Stop. I want to come now behind it, and you see how it's the blue was injected. Amshe. Stop. Inject. That's a good elevation here. Stop. I will bring back my scope and see now all my lesion. So I have to inspect all this lesion. We'll put more water now. And I see all the surrounding tissue. Is it blue? It's blue. So we are in the safe place. But it's a little bit big for EMR. This is the posterior part of the lesion. So if I will use an EMR technique, I will begin by releasing my snare in the distal part, maybe from here. We can also do our ESD as it were discussed. I will just inject some more blue in the upper part, and I think I will proceed to EMR. خرج لك بيها. Injecte. So I will to catch all this lesion. Stop. خبيه. So now the decision is dissection or EMR. Still thinking. I'm looking for where to place my snare. Even a cat won't be really difficult. Knife. So I will proceed to dissection. The edge. Yeah. So we can help ourselves using an hybrid technique, which is dissection all around and then finish with EMR. I have big vessel there, so it will sure bleed if we do our EMR, but with the ESD we can control what we are cutting. So I will search for the cecal part of my lesion. So of course we want to see what we are cutting. I don't put any marker. This is the distal part. So I can cut from here. This is the entrance for distal part. And I see at the left part the limit of my polyp. So I will turn a little bit to avoid. And this is a little bleeding. It's not an issue. We'll just coagulate it there. Stop alone with water. أمانكم حاجتي بيستوري باش نعرف واحد بجنبي يشوف ريت البيدال حاطينه راي علاش ربي ترى قلت حطو قدامي يولي. So I have to control my so I will go now from the distal part, the cecal part, and try to come back and then cut the rectal part. So this is our blue. I see. I hope we can cut here. So my edges are okay. We have maybe 5 millimeter edge. I have to get back away from the lesion, like this. So now I will go to the cecal part. I just want to control this bleeding here. I will switch to the saline immersion technique for coagulation, this little vessel. And you see the freezing effect here with the water. I will cut now the distal part from here to the so we have to take our time. One millimeter to cut to reach the other two parts like this. So I will use little cutting like this. So the lateral part is done, and we see a lot of little vessels there. I want to cut this little fiber here. The water will help me to open my space, and now I will go for the distal part, the cecal part. I think we need some injection there. I have to control all little bleeding because I want to get clear field. We see the muscle layer there. We have enough space to cut our mucosa here, submucosal layer. So I will continue cutting the proximal part. So I will take the edge here, put my knife inside, and cut slowly but surely. We have 2-3 millimeter security edge there, and really applying little cut. We are in the best position now for cutting. We see our submucosal layer there. This is a saline immersion technique. And you see how we cut slowly our mucosa. So for the immersion technique, we have always to put water. I have to get another direction far away. The little vessel there. We'll coagulate it before doing anything else and then correct our direction. This is the freezing effect. So I want to get a little bit far away from this edge. So I will pull back a little bit my scope and try to cut from here maybe. It's not the best position, but we will do with it. So I think here it will be okay. So this is a little bit far away from our polyp. So it should be okay. We go more in depth. So this is what we don't like when we are in the distal column, the transverse one. We are not so stable. So I will take this part and go down. So I will go back now to the other side. If I can stabilize my cap on this part and come like retroflexion like this, but always moving. So the best thing is to cut from here. I see the distal part there. We cut it in the other side. So if I can take this part here. So we go slowly now. I will turn to the other side and go use my up-down wheel to get the up direction. My polyp is at 11 o'clock position, so I want to get from here and cut while I'm going up. I see the polyp there, so we have to go not in this direction, but in the upper direction like this. So I will pull back a little bit my scope, anchor my tips there. Maybe even change direction from here. You see some vessels there. I don't want them to bleed, so I will put some water. I want to see my knife cutting in the good direction. And anytime you lose your view, you have to stop cutting. So we have to go in the upper part now. This is like a stalk here. I have to always get control on my cutting. And you see the polyp is here, so I will check again what I cut. So we are almost at all the circumference of the cutting. And here I can change and go for mucosectomy. So we have bleeding vessel. We have to control it, of course. I won't leave anything bleeding now, like this, and it stopped bleeding. So I will cut this part now, and I will come back to the cecal part of my lesion, which is here. So I have to just to cut these two parts. So I will come again from the lower part of the lesion, but I just want to see where this blooding is coming from to stop it. It's just here. We see this bleeding there. Little vessel, but we see our vessel there, so it should be easy to. So I want to go now to the lateral part, like this, and little cut until we will go to the. So I'm pretty happy with this. So if we can cut from here until the other part like this. So this is a good direction. So this is the problem with ESD, is always have to focus on your direction. So if we reach 1 centimeter next, we will go now take care of the lateral part and go dissect the proximal part. And this is the bleeding. It's not issue, of course. We reach at the other part now. So I will just use my water to see where is my bleeding part. And it's here. The vessel is there. I see my vessel there. I have some bubble of air. I want to catch them out. We cutted the vessel now. This is a submucosal layer. So I won't cut it now, but we can, of course, cut a little bit. And we see how the cap is doing some traction on the other part. So I will try to use my underwater, my immersion saline technique, like this. And help myself with the cap to make some, and cutting this fiber slowly. And I have to check where I am now. So we have to cut a little bit from the mucosa here to go to the other side. This is the left side of the polyp. So we have to cut it from here and check always where is your polyp. So we have the best edges now. We are maybe 5-6 millimeter from the edge. So I will turn back a little bit my scope and try to have a better direction like this. Of course, bleeding. This is what can occur, so we have to control it. It's coming from here, and I see the bleeding there. So I'll put my Usually we can stop it with and you see how the field is really not clear with the blood. That's why we don't like bleeding when we are doing saline immersion ESD. The blood vessel is there, so I will coagulate this part before and now go to take care of the bleeding part, which is in the upper edge here. Be able to see it in front of me. So water there, and I think the vessel, if I stop, I will see the bleeding coming from. So I'm coagulating with the, I think we've stopped now the bleeding, but there is a place there. We have the cap that is doing the compression there. So I think this is the vessel who was bleeding. So I will pull back a little bit my scope and be sure that we are not bleeding. So I think we are almost at the circumference cut of all the lesion. I will clean my field from the water and try to take a look again. We are using Swift Coag for dissection. So I think we sucked the maximum of water. I will come back to my lesion now, but I think almost all the job was done. So I will cut only maybe 1 or 2 centimeters remaining here in the left side. And we see how the blood vessel in the submucosal layer are here. So that's why we will have some bleeding there. You see, this is our some blood vessel there. So I will continue cutting from here. I will put my knife there and try to go to the upper position. And you see the blood is coming. I will apply some Swift Coag there. This is the distal part, and this is the bleeding vessel is here. So we will use the frozen technique for coagulation with water. But we have to have a clear view, but with the blood, it won't be easy. This is the point of bleeding. So we have to just to locate with our cap, get out the bubble of air there, and try to locate the vessel, which is here, I think in the upper part of the edge. So a vessel stopped here, but there is one in the middle of the screen. Still bleeding here. And it's just on the jet of water here. I see it's just here. And this is the freezing effect of the water and swift coag, and the blood was stopped now. So I will cut the submucosal layer here. You see a lot of vessel, so I will just coagulate them before cutting. And you see how the frozen effect is cutting this submucosal layer. So I will check again now my lesion. The blood is stopped, and I have to cut the 2 centimeter remaining and clean all my blood here and check again if we have still bleeding point. So the aspiration is only water now, but I see still some blood coming, so we have to locate this origin of the blood. I think I will just get into the submucosal layer like this here. I will put some CO2 and see where is my bleeding point. Maybe here. No, there is nothing here, but I will cut this layer here, and this is the distal part of our lesion. So the bleeding is from here. So I have to locate my bleeding. We see a lot of vessel there. So when I'm washing, I see the vessel disappearing. So I have just to put some water and use the frozen technique like this. So cutting, coagulation in the same time. Now we can now begin the cutting of the submucosal layer, and just then we will leave little flap, mucosal flap. This is some, we can coagulate here. It's not spray coag. And some vessel there. I want to control my cutting. We are still in the submucosal layer. So if we cut this part here, we will get an easy access to the upper part. And you see how the fibrotic tissue here. So all the circumferential cut was done from the right side. We have to check the distal part also was done. So we have just to now go to cut 1 centimeter remaining between the cecal part and the left part. So I'm pulling slowly back my scope to see where is my cut, which is here. And if I follow my cut, everything was cut here. And of course, we can cut here as we have the pressure of the cap. So we are cutting here the submucosal fiber. We inject some blue. So we see the blue coming there. Share. Stop. So little cut, not to blot. So the cap is helping us for traction. We see where is the water. So this is gravity. So we can go and turn a little bit our scope to work with the gravity and try to put like this. So, and you see, if we begin cutting from this part, this is with help or with gravity. Of course, we can change the patient position if you want to do underwater. But what I will do, I try to stabilize myself here and inject some blue here, like this. So I see the muscle layer there, but I need to have some blue there before cutting anything. Inject là. So we see the blue coming. Stop. I will go inside injector. ستوب. قاعد يمشي ولا إيه؟ أغزلي قاعد يمشي ولا إيه؟ فماش باش يمشي ولا لا؟ So we see the submucosal layer now here. I have to just to put the tip of my needle knife. I inject here. And we see the blue coming there. Inject, inject, inject. So my cutting place is better now. I will inject some blue here also. Inject. Stop. It will be little cutting here because I see the muscle and I have to just cut the like this. So I'm not in my best position, so I will change and maybe I will go to the other part and use my cap. We'll take the water, come back here. This is our lesion. So I will have myself with gravity, stabilize myself, take this nodule outside my cap. This is not my best option because we are near the muscle with the needle knife. So you see it coming out from 5 o'clock position. This is best approach here. So I will just try to insert my cap like this. So if we resume, you have a circumferential cut now. I want to check where is the best place to cut. Maybe it will be here because I see my submucosal layer clearly, and the cap will help me to stabilize my. بربي الخيوط امانكم الخيوط هكا علاش هكا بربي علاش هكا علاش. So we have to deal. يعني تو هي هي بالخيوط انت اللي هذاك بغادي وكا هو سيتو. So I think we have some tension here. This is the gravity, so we can use it to help us to cut the lot of little vessels here. So we can cut them. I will just coagulate before, like this. This is our submucosal fiber. So we can cut here with coagulation, but we coagulate the vessel before, and then we use our undercut cue, like this. We have a vessel here also, so I will coagulate it also. And we see the tension with the cap. So I'm doing an undercut cue now with a little cutting, really little cut, little pressure on the yellow pedal. This is avoid the bubble effect. So cut by cut, we preserve our muscular layer. I will go back to undercut cue effect 1. I think it will be enough. This is a vessel, so I will coagulate it before. It bleeds like this. So I will come back to this part of the lesion. We are using the saline for dissection and using also the gravity to help us. So this is we have to cut fiber by fiber and avoid injuring our muscular layer, which is in front of me now. So this is the submucosal fiber here. So that I can cut here easily. I'm using the water to really see better what I'm cutting. We see the muscular fiber there. This is the submucosal fiber. And you see how we have a nice clear view, and we cut fiber by fiber, and we have to control what we are cutting. I see my fiber there. I'm using the undercut cue. The water helped me to distend this submucosal layer here, like this. I have some vessel there. I will cut this little fiber here, but when I will reach the vessel there, maybe I will apply coagulation forceps like this, not so much. We are still in the submucosal layer. I have to cut this distal part here also. All this as and this is a vessel that will coagulate with the saline immersion. To frozen this vessel, I have just to be near him like this, and you see the white effect, and the vessel disappeared. You see a vessel there. You have to coagulate it before cutting. And you see how we have to cut really fiber by fiber with the undercut cue to not damage the muscular layer. So always focus on what we are cutting. We see a vessel there. This is a vessel, so I have to coagulate it here. And this is a frozen effect. Once it becomes yellow like this, so we can cut with a swift coag. This is another vessel here. This is the undercut Q effect 1 to cut this fiber. I see the muscular layer there, so I'm pretty happy. We can cut easily here. So I will be cutting now here near the mucosa. So you see the difference. This is the swift coag mode, so we can always have some bubble, but it's helpful for coagulation of vessel like here. This is a bleeding occurred here, and this is a freezing effect. And you see how we use a little vessel also here. A lot of little vessels here, but we have to coagulate everything. And you see how the frozen effect is really helpful. This is still the fibrotic region of the submucosa. This is the frozen effect. This is the submucosal layer. I can cut without being afraid of perforation, as I am helping myself with the cap. I inject it. I will inject some blue now. نهد حشت انت خدمتك الوحيده الانجكسيون راهو. انا السوغان قاعد تبدا قاعد يمشي ولا إيه؟ سي بون ترى. I have one vessel here. We'll coagulate it, and then I will just cut with. And you see, as I'm putting water, still little vessel here, the frozen effect, and then I will go back to my vessel, put water and see where it is exactly. This it is here. The frozen effect, it stopped a little bit. I will go back again, and I see it where it is, so it's here, it's okay. So we will have to avoid, this is the muscular layer here. And you see how a lot of little vessel here. This is what are bleeding. So I'm cutting with the undercut cuna, but I'm far away from the muscle layer. That's why I'm cutting. Here we have some vessels, so I will freeze them. Here I can cut. Some vessel here we can cut. So we have some fiber here that keeping the lesion in the upper side. I will cut them. And if you see, I am really near the mucosa here. Little vessel there. So we see this vessel and all of the fibrotic submucosal layer. So I'm trying to cut all this here. And you see how it's really. So the purpose is to be really always near the lesion, avoid the muscle, and go slowly. Like this. I see my submucosal here. And all this vessel, we have to coagulate them. So the best thing now is to go under this lesion with the cap. We have just 3.7 channel with a 13.2 millimeter scope. It's not a pediatric one. That's why maneuverability is less than a pediatric one, less than a gastroscope. So, so this is it's like the muscular fiber, but I think it's the submucosal fibrosis. It has the look of a muscular fiber, but they are not muscular fiber, so we can just coagulate and cut them. So we'll take a look at what we have done now, and you see the upper part is done. So I will try to inject some blue from here and see if we can inject it. So we inject our blue injector. So we see the blue coming, stop. I will try to get an access to the submucosal layer here, open it with the water, coagulate my vessel, and then do little cut. So if I want to cut, I have to put my cap really inside this part. I will coagulate here before. And I see my layer there, the submucosal layer. So I will cut slowly. I have to take all that bubble of air. So we are in the best position now because we are not in the direction of the muscular layer. Inject. So I will inject. تو قلت لك 100 مرة أمانك علاش هكا بربي قلت انجكت ما قلتلكش خذ سرنج أمانك قاعد تمشي ما عنديش بلو يا أخي معناها كلامي شنو معناها كيف نقول لك ديما سرنج حاضرة كي تبدا يدك في السرنج ما يرجعش فيها حتى شيء بيرجع حتى شيء راهو ما يرجع حتى شيء خاطر فما حتى شيء كيف تبدا فارغة هواء في وسطها كيف تعمل كواغيولاسيون يدخل فيها وسخ هذيك سي بور سا تصدى شاك فوا انجكت So we inject more blue here. I will just go here to this vessel. So inject here. I have to have more space in the submucosal layer here, stop. So I will cut this part and go towards the left position. The water will help, of course. Of course, don't forget the blue pedal means more bubble. The undercut cue, you see a vessel here, so I will coagulate it. And I will try to keep myself here like this. We are parallel to the muscle layer. So I want to cut this place here, but I have to put the cap really to stabilize my cap here. And until we will see a flap of the mucosa here. And of course, if we can take out the right place here, we will have best flap of the mucosa. So we have to cut all this left right part. And you see how I'm cutting tangential to the flap. So I'm avoiding the muscle. So it looks really easy, but we have to stabilize our scope. And with this kind of scope, maybe with a pediatric one, injector, I put some blue still here. Stop. I put my water under pressure to open my space like this. And now I will use my undercut to open this space from here. But of course, always contrary. You see this little resistance here, I will cut it. So we have to cut this place here. And we see clearly here the submucosal layer. So if we can detach from here, there's some fibrotic fiber here from the submucosa, so we have to release them from here. I see a vessel there at 5 o'clock position coming from the muscular layer. So I have to coagulate before cutting. I'm waiting for to become white like this. There's another one near him here. This is a submucosal layer so we can cut easily. I'm using the Swift Quack for the cut here, but really little cut, vessel there. And how beautiful this vessel here that will bleed surely. And we frozen it and it disappeared. So now we can cut. المية هذول يعدوا فيها. Another vessel there. هاي عدوا فيها ولا مازال فيها؟ ها؟ So we change the irrigation now. I will check my lesion again. So I think this will be the last flap of mucosa we will cut. I will leave it at last. This is the vessel we seen. We have to coagulate it before. Like this. And then we can continue cutting. So I will just leave, inject it. We'll inject some blue to enlarge the submucosal space. C'est bon. So I have more place to cut here. I will continue cutting this part. I will try to enter behind this inject here. So this is submucosal layer. We put the maximum of blue and try to cut here. So we have this nodule here who wants to keep us working. So I will try to just put my cap so we have to avoid like this. So we can cut the big vessel there. So this is the middle of the screen. There is one big vessel there. We can try to سكره كواغراس ما سمعتنيش اي حضري. We use a soft coag 4.5 for this vessel. So it is larger than the tips of the knife. I think it's better to consider safety and change device. So I have to found it again. So the mistake we have made, we don't have to lose our vessel. I don't know where it is, but I think it's there. Hello. So it's up here. Sakara. I think we grasp it. I will put the water there. Pull back a little bit the vessel and the scope and apply. It's the best to see what we are coagulating, but now it's hidden. I will pull just hello. Sakara. I will control again. We have to see it. It's still there. I see it now clearly in the middle of the screen, but I'm not so stable with this scope. Hello. سكر سكر. حل. سكرة. I'm sure I grasped it now. With the water we have less effect. We'll put some air and try to see the vessel now. Hello. سكرة. And hope it become white so we can cut it. I will just get out some water and some air to decompress my colon. هذا النايف. أعطيني injection. injection. I will use the needle knife, the needle to inject some blue, and you see what's remaining. Almost. أعمل purge ده كان. So I won't get out my needle. I just will inject below the cut I have done here. Inject, yeah. So we see now the sub. عملت purge يا أخي. عم purge. ريت الهواية جاي ريتا. عامل purge متاعك. ريت هذاك جاي. زيد امشي 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 امشي. سي بون. انظر بيورج راه لازم تشوفها ولا تعدي 3 سي سي في هذه في الوحده. انجكتي 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 انجكتي. So we see clearly our امشي inject injectي. I will inject the other part now. انجكتي. Stop. I will inject this part here now. Injector. So you have to be near injector. So we see the vessel, we cut it. Stop. I will try now to get access to my submucosal space. I will inject. Stop. تعرف بلاستيك غادي راهي انجكتي. ستوب. انجكتي. خذ سرنجة أخرى خذ. So we inject the maximum and then come back to my this section. Inject, stop, inject, son, inject, stop, hit knife. Shama. So now we have injected our blue. We should be more confident with the cut. So I have to stabilize myself. So that's why I will take some air out. Maybe some water also out and use just now the gravity. هيحضربك علي عادي. So here we are again. I will check for our lesion. So I think now we can use our gravity. We see some fibrotic region there. خرجة. I will work on the underwater, under saline, and try to cut this region, but I think I will more if cut this part here. And you see fiber by fiber. And we have to keep ourselves in the, get out all the bubble of air here to can work easily with the immersion technique. So this is all the submucosal layer. So we can cut easily with but I'm not really stable. Maybe with a thinner scope, we gain access to the submucosal layer. We see the submucosal layer there, space, but بربي اقعد غادي بربي يا ناهد اقعد من غادي ودور. طاولتك حطها من هنا، حطها من هنا، ما تنجمش تحطها، حطها من هنا طاولتك، حط طاولتك من هنا. قربها ليك انت هكاك، قربها لها هنا. So I don't want to cut when I don't see anything, but I'm not really comfortable with this vessel here. We have to coagulate it still more, like this. And this is my submucosal layer. So now I can cut my vessel, but with really little pressure on my I'm cutting in the direction of the submucosal layer and not the muscular layer, and I see from far away some vessel here, so I can coagulate them, and you see how the water helped me to push away the muscle. This is the last part we will cut, so I will cut Xylo. Injector. Inject. So I'm putting some blue in the upper part of the lesion. Stop. Injector. So we see how the derivation is done. So I will be more confident cutting with this security submucosal space. Just we have to get access to this space. This is the vessel we have to cut here. So I think we will cut it now. So really it's not the best condition. But I'm pretty happy because I'm cutting not in the direction of the muscle, helping us with gravity, with water, and we see clearly here the submucosal layer, but we have to suck all the water up here, all the air, to can enjoy the immersion technique. And I think we are almost done. If we can cut more fiber here. So we really have to be near the. And this is what I want to see, this little fiber, but I'm not at all stable with this cap. And this is what we have to see and to cut. Another vessel there, so we have to coagulate it. And it begin bleeding here. So this is my vessel. And then we can cut. And the vessel is still here. So here we have to be cautious because we are facing the muscular layer with our knife. Injectez. I will put some blue. C'est bon, c'est bon. So I will focus on this part of my lesion and try to cut this fiber there. So the best thing is if we are able to go just behind this, and you see how the submucosal space can be opened like this. But I think I will change maybe if we go from up to down. Try just to find our lesion, which is at behind this region here. This is our lesion. So we are now just cutting this little part here. I will use the water to avoid cutting any muscle there, but I'm sure it's I will take back my lesion there. This is the place we have cut, and the air, of course, is disturbing us. So I will just take my up here. So I will anchor my tip of the snare. This is the vessel we have cut. I will take it like this and try to do a little cut and until the vessel disappear, and we can enter our submucosal space there. But I think we are almost done here. And you see how the cap is always keeping the polyp there, and this is what we want to reach, but we are not stable. So maybe we can try to cut like this. And this is what I don't like. This is the bleeding when you cut from far away. So I will come back from far away and try to locate. So it's a little bleeding, but it will disturb the immersion. So I have to get out all this water and then go to direct vision with CO2, locate my bleeding point, which should be here. I'll get the water Can you see how blood is coming? So where is our lesion? It's here, and the only way to see the bleeding now is to go with the water, try to locate. I know where it is, but usually we don't have to lose the point of bleeding, which is here just behind this nodule, and I see it in the middle of the screen, but I have to put my scope just, and I see the bleeding there, so I have two choices: try to coagulate it with the knife or maybe use a coag rasper, and we see all this submucosal fiber, and my bleeding is there, and I have really a place to cut the vessel and the submucosal layer there. So I will try to stay in this position